Diagnosis has to be the hardest part of Chinese medicine. Today, I want to dive into the 10 most common questions we ask each patient and how to differentiate each answer to form a diagnosis. Because once we have the right diagnosis, we can pick the right point selections. There is no wrong treatment in TCM, only the wrong diagnosis. This is why it's really important. So today I'm going to look at energy, sleep, digestion, all the common questions we ask patients in order to make a diagnosis and how to differentiate them all in order to pick the right point selection and to care for our patients in the best way possible. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's go. Let's start with sleep. Often we ask patients, how's your sleep? And they might say, it's fine, because they're so used to not sleep properly that in their mind it might be fine. So it's really important to not just let it go at that question, but dig deeper and ask more details. Do you fall asleep easily, stay asleep, and wake up refreshed without being disturbed by dreams or waking up? And suddenly people will say, well, maybe not. So let's differentiate those answers. If someone cannot fall asleep easily, they take an hour to 2 hours to fall asleep, that is either liver over-control spleen or wood over-control earth, which means liver qi stagnation, depleting spleen and creating spleen qi deficiency, or it could be a spleen and heart blood deficiency. So you need to differentiate with other symptoms in order to know which one it is between the two. If someone tosses and turns all night, that's a yin deficiency. If someone wakes up between 1 and 3 a.m., that's a liver problem. Now, if they fall back asleep within a few minutes, that's a liver yang rising. If they cannot fall back asleep, that's a liver fire. If someone does not feel refreshed and they feel really tired in the morning and they can't get out of bed, that is a spleen qi deficiency. Morning time is spleen and stomach time. So when someone is really tired in the morning, that is a spleen qi deficiency. And then there are dreams. If we have dream disturbed sleep, it could be a heart yin deficiency. If there are nightmares, it's phlegm fire in the heart. However, if it's the same recurring dream, it's a gallbladder qi deficiency. Very different, right? This is how we differentiate those symptoms. Make sense? And the last one is those who don't sleep at all. Not 1 minute, for weeks or months. That is heart fire. So see, this is how we differentiate a common question, how is your sleep? Question number 2 is about sweat. Do you sweat easily? And again, sleep and sweat are related to the heart in TCM. As a heart function, heart is in charge of sweat and it's in charge of sleeping. So when it comes to sweat, do you sweat easily? So there's 2 answers. Either the person sweats at night, and that's heart yin deficiency, or they sweat easily during the day without being hot, often when they're anxious, and that's a heart qi deficiency. The other answer is I never sweat. Years ago, before I went back to school for TCM, I used to personal train and work in the fitness industry, and I had this client who never sweated. And she worked really hard. She did a lot of cardio. She did a lot of workout, really hard. I was watching her. She never had a bead of sweat on her clothes. That is a heart blood deficiency. Next question is, how is your energy, right? After sleep, obviously this is correlated. If we don't sleep well, we don't have great energy. How is your energy? What I like to do when I ask about energy is from 1 to 10, 10 being your best energy, where you at? Most patients are going to say 3 or 4 when their energy is low, 7 when they don't have top energy, but they keep going. So if they say 7, they're probably a 5. They're just so used to go on empty that they will say 7. Make sense? So for those patients, I ask 2 questions. How are you physically and mentally for energy? So physically, we also have time of day. If you have no energy in the morning specifically, that's a spleen qi deficiency. And if you have no energy, never, you're exhausted all the time, most of the time it's a yang deficiency, probably a spleen and kidney yang deficiency. We have to ask more questions, but that's the result often when it comes to energy in the morning. Now we have mental energy. If someone is mentally exhausted, usually it's due to the amount of stress, so there's liver qi stagnation, put upon their spleen, which is overthinking, over worrying, and gets depleted and creates spleen qi deficiency. So no matter what, mental or physical fatigue is going to affect the spleen because the spleen is in charge of bringing clear qi to the mind for focus. And sometimes when we use our mind too much and we don't eat the right nutrients, we deplete our body. So that's an easy one. It's mostly a spleen issue when it comes to low energy or fatigue. Now, if someone is blood deficient, they can also be fatigued, but blood deficiency usually comes from spleen qi deficiency, not able to produce blood. Make sense? Okay. And the next question is about digestion. So the first thing we'll ask is, are you eating regular meals? What's your diet? We need to know what the diet is in order to know what's going on. It's really important. Also, if a woman eats a lot of raw, cold food and she's trying to get pregnant and she's always cold, we need to know that in order to explain that we need warmer food, right? This is really important. So, are you bloated easily? Now, when it comes to bloated, we have bloated after meals, and that's a spleen qi deficiency with dampness. Or we have bloating that gets worse and worse as the day goes and is the worst at the end of the day. And when we wake up in the morning, the stomach feels flat again. That is due to stress. That is a liver qi stagnation bloating. See, this is how we differentiate the two. How is your appetite? Oh, it's pretty good. I eat well. Do you have cravings? So appetite that is poor, meaning there's no appetite, that's a blood deficiency. If there is cravings, that is also a spleen qi deficiency, not being able to transport. Maybe the person is not having a good diet. If we are craving sweets, that's a spleen issue. If you're craving salt, that's a kidney issue. When it comes to digestion, the next step is asking that question about bowel movement. When it comes to bowel movement, we ask, do you have a bowel movement daily and is it easy? Now, if this is not the answer, let's look a little bit deeper. Constipation means that we may strain or we don't have a bowel movement regularly daily. Diarrhea means that we are going to have loose stools or worse than that, which is diarrhea. It could be once a day, it could be more often, twice a day. That is a different one. So let's start about constipation first. If we are straining, if there is gas and easily bloated with stress, that's a liver qi stagnation. If there is a painful abdominal region and when we have a bowel movement, we feel better, that's excess in the large intestine. And if the bowel movement is smelly, that's excess heat in the large intestine. Does that make sense? Okay, so it's looking at going a little bit deeper. Now, the stools, if they're dry little pebbles, that's a yin deficiency. If they're big formed stools, a large amount, that's excess in the large intestine. When it comes to IBS, which is alternating constipation with diarrhea, this is often due to stress. So it's a liver qi stagnation creating some spleen qi deficiency or wood over controlling earth. When it comes to diarrhea, 5 a.m. diarrhea or early morning diarrhea, basically the one we have when we wake up, is a spleen and kidney yang deficiency. A diarrhea that's really smelly is damp heat in the lower jiao. No matter what, when there is diarrhea, there's a spleen qi deficiency. I'm talking if it's chronic. If it's acute, it's external pathogen invasion, so that's different. But if it's chronic, then that's a spleen qi deficiency, and then it depends when it happens, what it looks like, the smell of it, then we can have damp heat if it's smelly, like I said. If it's urgent, painful diarrhea, often it's a liver overact on spleen again, and it's kind of like IBS or irritable bowel syndrome. And diarrhea that is better with a warm compress on the abdominal region is often a cold, damp diarrhea. See, this is how we differentiate those questions. Simple, straight to the point, and that's how we make a diagnosis. Next question. Let's talk about the question about urination. The first thing I ask is, do you get up at night to pee? And if the person drinks a lot of tea before they go to bed and they get up once, that's pretty normal. But if they don't drink anything, I have lots of patients that say, I stopped drinking anything by 5 and I still wake up 3 to 4 times a night to pee. We know that's the problem with kidney qi not opening and closing the lower gate properly. So that's a kidney qi deficiency. Also, if there's bladder incontinence, that is either a spleen qi sinking, if the bladder is prolapsing, or it's a kidney Qi deficiency, which we know is worse when we cough or laugh or run. Bedwetting is another one that if I treat children specifically, we can ask the parents about bedwetting. And bedwetting is literally the child has fear. It could be irrational fear or rational fear, but a child that is bedwetting or wetting the bed is definitely a child that is fearful of something. So you need to dig a little bit deeper and figure out what is the child scared of, because that fear is controlling the kidney and the kidney is not able to do its job, and then there's bedwetting. When it comes to urination, the color of the urine is also going to play a role in how we diagnose. So if someone has a urinary tract infection or a bladder infection, this is usually damp heat in the bladder, and it's going to look with murky, dark urination that is going to be urgent, painful, and burning. So that's easy. The second one, also urgent, painful, and burning urination, is not an infection. So that's a chronic issue like interstitial cystitis. And that is usually hard fire moves down to the small intestine, because in Chinese medicine, the small intestine is in charge of separating the clear from the turbid. And heart fire moving down to the small intestine means that the emotional state of the heart is not quite healthy, and it's creating a problem with the urination. And I see this with interstitial cystitis a lot. Patients usually have insomnia and a lot of traumatic emotional trauma that create that interstitial cystitis or that painful urination that is dark, urgent as well, but there's no infection, right? The other one is when there is painful urination after intercourse. That is usually damp heat or fire in the liver meridian, the lural collateral meridian, because the lural collateral starts at liver 5 and comes up and wraps around the external genitalia. So when there's a herpes outbreak or there is urination that's painful and urgent after intercourse, that is a liver fire or damp heat in the liver meridian. Usually this person also has anger or irritability issue and headache that feels better with a cold compress. The last one is if there is dark, scanty urine accompanied with constipation and thirst for cold drinks, and that's chronic, that is large intestine heat, which also reflects into the urination. That's bladder heat and large intestine heat. See, this is how we differentiate. Good? I hope you're really enjoying this. And by the way, if you haven't got your copy of my green book, which is Chinese Medicine Made Easy, it has all the diagnosis, all the graphics you're seeing today to help you really narrow down your diagnosis and improve your skill when it comes to this difficult part that is TCM. The hard copy ships all over the world, or the PDF digital version has video links to complement it. No matter what, they both come with my fillable intake form that you can use for your patient. The next question is pain. Obviously, some people come to see you because they're in pain, but in general, we're going to ask, do you have any pain anywhere in the body? And people might answer with headaches, knee pain, back pain, wherever the pain is. First, we have to look at the quality of the pain. If it is constant, meaning it's always there, versus it comes and goes. If it's constant, it's blood stasis. If it comes and goes, it's a liver Qi stagnation. If it moves, it's a liver Qi stagnation. If it's fixed in the same area, it's a blood stasis. Let me give you some example. Dysmenorrhea, the pain is in the lower abdominal, it's fixed, it's stabbing, it's strong, and it's constant during the menstruation. That is blood stasis. Liver Qi stagnation pain would be come and go. So the pain that comes and goes could be arthritis. And the person can say, yeah, sometimes it's my wrist, sometimes it's my knees. So it changes location. It's not always in the same spot. It moves and it's not constant. That's a liver Qi stagnation. Now that pain that's arthritic, maybe it's worse when there is cold weather, or when there's hot weather, or when there's damp weather. Now that means there's liver Qi stagnation with damp, or with heat, or with cold. Does that make sense? Okay, so a pain that feels better with a cold compress is excess heat. A pain that feels better with a heating pad, that's excess cold. Yes? A pain that is dull, not very strong, is always a deficiency. A pain that is always strong is always an excess. Heavy pain or swollen pain is always dampness. Now, where is the pain and what does it affect? If it affects joints, ligament, tendon, sinews, it's a gallbladder, liver issue. If it affects bones, it's kidney. If it affects muscles, it's spleen and stomach. Make sense, right? And if it affects nerves, it's usually a liver problem as well, because the liver is more connected to the central nervous system. And then depending on the location of the pain, we can figure out what meridian is affected. Like kidney is always knee pain or low back pain. Liver is ankle pain and rib pain. Large intestine and small intestine are going to be elbow and shoulders. Hip pain is going to be a spleen-related problem. Jaw pain is a spleen and stomach-related problem. Jaw pain, usually people clench when they worry, overthink, and stress, and that's where the jaw pain comes up. Make sense? The neck pain is actually a long meridian issue with a bladder meridian issue, because the long 7 is the commander point of the neck and head. Right? So we look at all those pain and location and we try to figure out what is affected and we can make the proper diagnosis. Yes? Next question is, do you have headaches? And a lot of people that have headaches weekly think it's normal because they think maybe everybody else has a headache every week. So I always have to tell patients, a lot of people don't have headaches. Do you have headaches? Never, ever, ever? And they're like, well, no, maybe once or twice a month. Okay, is it prior to menstruation? If it is, then it's part of PMS. Is this a liver chi stagnation, right? So we have to dig and ask the question, the details. TCM is all about the details. When it comes to headache, the first thing is, if it's the whole head, it's a blood deficiency. If it's a tight band that's squeezing the head, that's phlegm. If it's on the temporal area, it's a liver gallbladder. If it's on the frontal area, it's a stomach. That is usually called a Yangming headache because the stomach is a Yangming meridian. If it's occipital behind the neck, usually that's a bladder-related headache, and we can use long 7 as a really good point for it, right? Makes sense? And then if it is on the top or the vertex, it's usually going to connect with the kidney and the liver. And if it's a splitting migraine and really painful pounding, that is usually blood stasis. This is how we answer pain. And the last question is the heat and the cold. Are you someone that is hot easily or cold easily? Now, a lot of people might say, I'm pretty even temperature, and that's okay. That means that those people are more balanced. But if the person is really hot all the time, they either have excess yang or yin deficiency. And we have to make the difference between the two. Now, sometimes people have both. That can happen as well. When it comes to temperature with excess heat, it's big symptoms, and yin deficiency is small symptoms. Yang excess, red face, yin deficiency, red cheeks. Yang excess, sweating profusely, yin deficiency, just night sweats. When it comes to yang excess, we don't sleep at all. The sleep is completely disturbed. While yin deficiency, we sleep but we wake up, we sleep but we wake up. The tongue for yang excess is red with a yellow coat, and for yin deficiency, it's red without a coat. The pulse for yang excess is rapid, big, large, full, and the yin deficiency pulse is rapid but thin. When it comes to bowel movement, when there's yang excess, the bowel movement is large, big amount of stools, while the yin deficiency is small little pebbles. For emotions, when there's yang excess, it's anger, it's like the volcano, it's bursting out, while yin deficiency is more irritability, nervousness, anxiety. So if the person is more on the cold side, it's either a yang deficiency or a yin excess. With yin excess, we're going to have pain, because that means that when there's yin excess, there's excess cold, which means it congeals. It becomes like an ice cube and it stops blood circulation and it creates blood stasis. So yin excess is going to have pain that is better with heat, but it's local, fixed, strong pain, like Raynaud's disease, where everything turns purple, but if you put heat, it feels better. Like dysmenorrhea that feels so painful, but when you put the heating pad on the lower abdominal region, it feels better. like hypothermia for something that's more acute and we're really cold, but once we start wrapping ourselves into warm clothes, we feel much better. Compared to yang deficiency, where the symptoms are going to be very fatigued, very weak, feeling cold all over, not just in one area, but all over. We love warm drinks, we love warm food and warm clothes. Usually there's edema of the lower leg or ankle area. We have low libido, we're tired all the time mentally and physically. That is your yang deficiency, no fire, no heat, no energy. So that's the difference between the yang deficiency and the yin excess. Those were the 10 most important questions that we inquire with each patient. Of course, there's other questions, but those are so key to help us in our diagnosis because they're very prevalent in everyone's life. And if you want more, I have so much more on my website, acuproacademy.com. I have tons of resources, free courses, PDF, case study. All you need is on that website. And by the way, I also have a podcast now where I invite guests and we have great conversation on TCM. The AcuPro show can be found on Spotify, Apple, and anywhere you love to listen to your podcast. It's completely free every Wednesday. Make sure to follow the show. So I hope that this was very detailed and really helped you into narrowing down the TCM diagnosis and help you reach better outcome for your patients. And if you haven't watched yet my diagnosis videos, check them out here. There's a whole playlist. It will help you tremendously because I go in detail with each pattern of TCM diagnosis. Have a fantastic day, and no matter what, keep rocking it using TCM.